this is going to be addressing the impact of severe early stress on brain development and consequences that unfortunately can last for a lifetime. And to look at this, we'll be looking at two different types of early child abuse, pathological neglect and trauma. And trauma being defined as being really tremendously painful or frightening event that occurs where there is an inability to escape, where the person or in animal research, the animal has no opportunity for escape, okay? And the reason I'm talking about these separately is because they each have very different neurobiological consequences. And of course, you know, as clinicians, you all know that many times people who've had early, really bad things happen to them have had a combination of trauma and neglect as well. But so it may seem artificial to separate them out. But the reason for doing that is because, like I said just a moment ago, they have a different kind of impact on the developing brain. So we're going to talk about trauma first, and let's go back to 1937, Hans Selye. And he was very famous for mapping out the territory of some early information about biological changes that accompanies trauma. He eventually was known as the father of stress. Yeah, I mean, how would you like that to be your legacy, the father of stress? Or how about the grandfather of depression, or what have you? But anyway, what he found was, and this may be repeating what you've been reading in Sapolsky's book, but I'm going to talk about it for just a couple of minutes. He had control subjects, rats that weren't traumatized in any way. And some people really question this. Well, okay, but what were the control rats doing? Well, they were in their cage. And so some people put forth the argument that, well, that's not exactly a control, because the normal place for a rat is out running around in the field and that sort of thing. But in any event, he had control rats that were not subjected to any kind of stress-inducing kind of stimuli, and then he had rats that were. And the rats that were banged around and loud noises and shaking the cage and this kind of stuff. He noticed a lot of his rats were dying much younger than they should. The control group, rats usually live to be about 2 years old, and then they usually get pneumonia or something like that and die. So he wanted to investigate what's the cause of this premature death, and he came up with some data and some theories to support that. Increased glucocorticoids. These are a set of stress hormones that are made by the adrenal cortex, okay? And what he found is serum levels of glucocorticoids were really high, something referred to, I think, before as hypercortisolemia. Now in rats it is not cortisol, but it's a molecule that is very similar to cortisol, okay? So they were rocking around, living their life marinating basically in toxic levels of glucocorticoids. And then he found that they, when you look at their blood, there was a significant decreased availability of white blood cells or lymphocytes. And that's really the first line, of the immune system. And so he looked beyond that, and he looked at tissues of the immune system. This would be the spleen and the thymus gland, and he found that they were atrophying, they were shrinking. And then most of these rats died because they got pneumonia. Rodents are very prone to pneumonia. The control rats would get pneumonia, but they'd fight it off and survive. But these rats were dropping left and right. And so his hypothesis was that the presence of chronic high levels of glucocorticoids was having a huge negative impact on the immune system, both by reducing the amount of white blood cells in circulation and actually the atrophy of lymphoid tissue. Well, he was basically right. So we're going to move on from there. I'll talk about some studies that use this paradigm, and everybody in Psych 101 has already heard about this, but this is inescapable shock, and this was kind of in its heyday back in the 1960s, where a lot of this research was not really governed by ethical guidelines. And these days, they actually do continue to do animal studies, especially if they're trying to get drugs approved, for instance, and animals are in a sense tortured, but not quite as severely as they were back then. But in any event, we're going to first talk about the findings from this early research in the 1960s and early 1970s. And I think you know what the paradigm is they put a rat in a cage and shock him over and over and over and over again. And of course, the immediate response is these rats, it scares them and it hurts, and so they're frantic and they're trying to get away. But it just continues, and there's no escape, there's no control of that. And then at some point, you get this real significant change in behavior, psychomotor retardation. The rats just sort of give up and fall, on the cage bottom, and they're getting shocked, but they're not even trying to run away. And the punchline is that you could open the door to their cage and shock them, and they wouldn't even run out. And so that's learned helplessness. Really, so that's what it was called back in the 1960s. And so if you take a look here, we see the acute effects are just what I described. It's like fight or flight response. This frantic trying to get us away from this shock. But with time and repeated shocks, then you saw this particular cluster of symptoms develop. And the first is sleep disorder. And what's interesting here is it's just not sort of generic sleep disorder. It's multiple awakenings during the night, and then also early morning awakening, and just highly reminiscent of what you see in humans with major depression. Poor appetite. In the worst cases, they would stop eating. It was the term they used was failure to thrive, and they would just starve to death. Okay, most of them didn't do that, but they were not eating as much as they're used to. They replicated the finding of cellular immune impairment and persistent autonomic arousal. And so, even though these animals, oftentimes they would detach socially, and they go sort of hide in a corner and hang out by themselves, and they look catatonic. They have severe psychomotor retardation. Now, these are the ones who had this the shocks over a prolonged period of time, and so they're not moving at all, basically. But you have the slightest little thing like a noise or flipping a light on, and they would just jump out of their skin. So they'd have this really brisk and intense startle response. And for the rats that experienced this shock over a period of several hours or a day, oftentimes within several weeks it would begin to go away. But when it lasted much longer than that, then it was permanent and lasted for the entire life of the rat. What wasn't really understood back then, though, is what's going on in terms of endocrine function and up in the brain.